people started dying during the second phase of the pandemic. We would watch TV, remember, you would put on the BBC top story, 500 dead, 200 dead, the highest deaths, especially among the old communities. In India, the crematories were active all through, they're burning people. I remember oxygen tanks being given people on the street. Health facilities were all booked out. It was a tough time for all of us. And I took some time off and I did a documentary that takes us back to what really it was, which I'm going to be sharing with you today, and why it was important for us to actually save people. At that time, it was vaccines that were very important. Now, when vaccines came in, everyone wanted to have a vaccine. But we didn't know when even those vaccines would come. Eventually, the vaccines arrived, but they came in late. Eventually, we said, how can we be able as a continent to actually stop going through what we went through in the future? And that's where the conversation of manufacturing our own vaccines started.
Also, part of the work AIIJ has done is looking at how have the different NRAs been able to tap into the work on vaccine, but also the stakeholders, the civil society movements, the media, enhancing your capacities in terms of appreciating the work on vaccine manufacturing and our role. So that's why partly we are here for this 2 days engagement. So that's part of the outcomes we want to see. I won't dwell much into them, but most important, and as I think Stuart will emphasize, we believe that the media have a very critical role in ensuring that we achieve some of the objectives of this program. Because at the end of it all, when you do this research, we need it disseminated to the policymakers, and you have a very critical role in ensuring these findings are reaching out to the targeted audience, but also the campaigns. AIIJ is also part of the campaigns we are running under this program. We want to ensure that the voice is heard across the region.
We have a reach of, raw materials that people in the European countries come, extract from here, do take, manufacture the API and bring it here. So as Africa moves from fill and finish, it could be the first stage that we focus on. Then move into the drug substance, be able to set up manufacturing units or processing units for these raw materials that we have. Then end up in research and development. I would like to see if we have been attentive. We began with some stats at the beginning.
So enjoy, please. Note down whatever it's intense. Note down, all my presentation is here. Note down if you find anything interesting.
Under the pressure of the ongoing COVID-19 pandemic,
I mentioned COVID-19, and we all remember the loved ones we lost.
Vaccine development and manufacture on the continent, then we can achieve something.
But it will take more than just hope, according to Patrick, the Executive Director of the African Vaccine Manufacturing Initiative. Patrick, who also doubles as the Chief Science and Innovations Officer at BioVac, a South African firm that produces vaccines, tells me that vaccines.
Sandra Nansunga, the African Institute.
Nice to see you.
Rahim Nwali, African Institute for Investigative Journalism.
Very nice to see you.
Also, we were excited to learn that the smallpox vaccine was actually done here. We're also looking forward to moving to the labs and have a first-hand experience of what really happens in terms of research and development of this work.
Okay, thank you very much. which we had started, would be somewhere. So if you say it is difficult, Africa will not do it, and all this, we are poor, no. Start the little. Maybe it's your grandchildren who will benefit. Don't move. So I think let's be ambitious. We may not reach there. Already the targets are being disorganized. I don't think we are moving at the speed we had anticipated. But let's set those targets and do whatever we can, because it's complicated, it's difficult, but we need to do it. I really support we need to do it. And slowly by slowly. Because as I said, you can start in fill and finish, you can start using other people's vaccines and the rest, but build the capacity, because we have diseases and infections that are irrelevant to Europeans and Americans. They will not come here. We have to address them. We have to address them.
All those processes require funding, additional funding to ensure you put in the application and go through the entire process. But I'm happy that at least we are the step of AREPO. It's our first step and we are very excited on that front.
These are samples that come.
7 years later, in 2007, there was a small outbreak of Marburg in a place called Kitaka. Kitaka is found in Conveying. There were 3 cases.
So this is Dr. Ann Kapata. She's a postdoctoral fellow working on the vaccine project.
When you get a sample from a patient, you then want to, because not all that blood is useful for you. You only need what they call the DNA or RNA out of that blood.
As scientists in Uganda, based at the Uganda Virus Research Institute, we are very, very grateful to the government of Uganda for having started us on this journey. We have gained capacity for SARS-CoV-2 vaccine development using 2 platforms, the inactivated and the adenovector platform. We have also gained infrastructure development in terms of equipment for both studies, as you've seen during the tour or you're going to see in the Lakes Lab. And we hope that they can continue to support us until we realize actual products for human use and clinical trials.
We have received enough training through the support of the government of Uganda to learn how to investigate immune responses, to learn how to grow viruses, and to learn how to deal with the mice samples that have been infected with the viruses that we are growing. So we have been funded and educated in these sectors, and they continue to fund us to learn better technologies like monoclonal antibody discovery and all the technologies, genetic analysis of human DNA. So we are being funded by the government of Uganda to become professionals in this, so that next time we have an epidemic or a pandemic, we can be able to tackle this on our own in the country.
So during that time of our scandals, people kept saying we can't make a vaccine because we don't have biosafety level 4. But these labs are based on the type of pathogen. So with COVID-19, you can work on it in biosafety level 2 and
the government can come and tell Cipla, we shall cover 30% of your power costs, reduce the products so people can have ARVs. But you cannot go and enforce such a measure on Pfizer when you are here. So local production, actually a study has been done by McKinsey, and it found out that if you do produce products locally in Africa, at least on average, they can be 15% cheaper than exported products. So, in other words, if you sit here and wait for it to change, it will never change, because the people whom you expect to change it are used to the same thing as him, and they cannot think outside that. That is why, where we are, he's saying we may not have enough personnel. I can tell you there are many doctors, thousands of doctors, who do not have jobs. Other doctors are being educated in Uganda. They are going to abroad and working in other different developed countries.
But also, because you're a big group, we have a boardroom on the first floor.
In history, HIV positive was a death sentence. If you were HIV positive, you die by 30-35. Today, if you live till 70 by taking one pill a day, it's not a death sentence anymore. It's like any other ailment, and which is a very, very positive, development happened over years by industry, by government, by big institutions. I think same set is possible for vaccines as well. There is a huge emphasis on locally produced vaccines. A vaccine is also a very complex pharmaceutical product. It's not simple. Anything which is bio-related is a biohazard, right? So take example what has happened with vaccine development itself, where the virus was originated, COVID. There were a lot of speculations at that time. Probably it's a leakage from the research lab itself, and that's the biohazard, right? So anything biologic has a risk of, if it comes out and is not manufactured in the right way, can lead to a bigger catastrophe.